In nursing, consistency is everything. It can be the difference between a patient getting better and a treatment just not working. And that consistency, it has a name: reliability. It's the absolute foundation of every credible study and every single clinical decision we trust. But what does it really mean when we say a tool or a method is reliable? Well, let's break it down.
Okay, picture this. You and a colleague are both looking at the same pressure ulcer. You measure it and get 3 centimeters. They measure it and get 3.5. Now, that seems like a tiny difference, right? But those little inconsistencies can totally throw off how you track healing over time. So, who's right? Well, the problem might not actually be with you or your colleague. It could be the tool you're using. And this is exactly where a lack of reliability creates real-world problems.
So, that exact problem, that's what reliability in research is designed to solve. It gives us a framework to make sure our measurements are consistent, which in turn creates a foundation of trust for everything we do in evidence-based practice. So what is it really? When you get right down to it, reliability is all about consistency. It's about how well any research tool, whether it's a questionnaire, a physical device, or even an observational checklist, gives you the same results over and over again under the same conditions. It's all about getting a dependable, reproducible result you can count on. Or here's an even simpler way to think about it. A reliable instrument is one that's as free from random error as possible. Look, every measurement is going to have some tiny bit of error, but the whole goal of reliability is to get that error down to a minimum so we can actually be confident in the data we're collecting. Now, it's not like something is just reliable or unreliable. It's not that black and white. Reliability actually exists on a scale, a continuum from 0 to 1. A score of 0 means your results are completely random, totally useless. But a score of 1? That's the holy grail. Perfect reliability, where the measurement is perfectly consistent every single time. So how do we actually test for this? Well, in nursing research, you're going to run into 3 main ways that reliability gets checked. Let's dive into each one so you can spot them and really understand them the next time you're reading a study. All right, first up, stability. This one asks a really simple question. Is the tool consistent over time? If you measure something today, are you going to get pretty much the same result next week? Assuming, of course, that the thing you're measuring hasn't actually changed. We figure this out using a method called test-retest reliability, and it's as straightforward as it sounds. You give a test to a group, you wait a little while, usually about 1 to 2 weeks, and then you give the exact same test to the exact same people. Then you just compare the scores to see how similar they are. A perfect nursing example is assessing chronic pain. Let's say you use a pain scale on patients who have a stable, ongoing condition. You wouldn't expect their pain to change much in a week. So if you use that same scale a week later and the scores are very similar, then you know that scale has good test-retest reliability. It's stable. And here's the number you want to keep in your back pocket. A reliability score, or coefficient, above 0.80 is generally considered good for stability. It's a solid benchmark that tells you, yeah, this instrument is consistent over time. Okay, on to our second type. We've talked about consistency over time, but what about consistency between people? This is where equivalence comes in. You'll usually hear this called inter-rater reliability, and honestly, it's so important anytime a real person is doing the observing or judging. The whole idea is simple. Can 2 different people watch the same event, use the same tool, and come to the same conclusion? A perfect way to see this in action is a nursing school, right? Imagine 2 instructors are watching a student give an injection. If they both use the same checklist and their scores are nearly identical, like we see here, that shows a high level of agreement. It means that checklist is a reliable tool for that specific assessment. And just like before, there's a target score. For inter-rater reliability, you're looking for an agreement score in the 0.80 to 0.90 range, or even higher. When you see that, you know the measurement isn't just based on one person's subjective opinion. All right, our third and final type of reliability is called internal consistency. This one is a little different because it looks inward at the measurement tool itself, especially for things like multi-question surveys or scales. What this really asks is a simple question. Are all the individual questions on this scale actually working together? Are they all pulling in the same direction to measure one single concept? Researchers often use a statistic called Cronbach's alpha to check this, and it basically just tells them how well the items hang together as a group. Let's take a depression scale, for example. Say it has 10 questions. If that scale has high internal consistency, it means all 10 of those items are truly tapping into different aspects of depression. It's not accidentally picking up on other feelings like anxiety or physical tiredness. Every item reinforces the others, making the final score a much more accurate measure of that one central idea.
Okay, so that's a lot of theory, right? But how does all this stuff from a research paper actually translate to the patient's bedside? Why is understanding reliability so incredibly critical for you and your day-to-day work?
I love this quote from our source material because it just hits the nail on the head. If the tools we're using to gather data are unreliable, then any conclusions we draw from that data are shaky at best. The entire foundation of a study can just crumble. So, what's the bottom line here? Reliability isn't just some dusty statistical term for researchers. It's what ensures patient safety, because it means our care is grounded in data we can actually trust. It's what builds our confidence in evidence-based practice. It upholds the professional standards and the credibility of our entire field. And ultimately, it's what allows science to keep moving forward, because other researchers can then verify and build upon those solid, trustworthy findings. So, I'm going to leave you with this question, a bit of a challenge, really. The next time you come across a new assessment tool or you read a journal article that could potentially change your practice, are you going to stop for a second and question its reliability? Because looking for that evidence is one of the most important things you can do to make sure you're providing the absolute best, most evidence-based care possible.